through the needles, freezing the prostate and killing the cancer. The average cost for prostate cancer chemotherapy is $12,760. The average cost of a course of a chemotherapy treatment costs $41,000. The American Cancer Society cervical cancer screening guidelines state that women should begin screening approximately 3 years after she begins vaginal intercourse and no later than 20 years of age. Screening should be done yearly with regular Pap tests or every 2 years using liquid-based tests. After age 30, women who have had 3 normal tests in a row may get screened every 2 to 3 years. Women 70 or older who have had 3 or more consecutive normal Pap tests in the last 10 years may choose to stop cervical cancer screening. And cervical cancer treatments include surgery, a hysterectomy using the Da Vinci robotic-assisted laparoscopic surgery, which is minimally invasive, intensity modulated radiation therapy, which delivers high doses of radiation to the tumor, and chemotherapy is also included. To prevent cervical cancer, the patient must receive Pap smears routinely, and Gardasil will be available to prevent HPV. Gardasil is a new vaccine that can protect against type 16 HPV, a sexually transmitted disease that causes cervical cancer, a new study shows. An estimated 5.5 million people became infected with a strain of HPV each year in the United States. And Gardasil is going to be optional for the patient. If they don't want it, they don't have to take it.
The average cost for cancer treatment, the yearly medical cost is $89 billion of the total health budget. Cost of lost productivity due to illnesses is $18.2 billion. The cost of lost productivity due to premature death is $112 billion. Just to sum all that up, in our pilot program, we will cut the cost by close to or more than a half by simply increasing the number of screenings done in our facility per year. Preventative care is the best way to detect cancer early, so we'll be able to help prevent it in the early stage. Once we can detect cancer at a much earlier stage, then the cost of the treatment and therapies will be less, and our facility will save a lot of money that way. This is our basic setup. First, the patient will make the appointment, whether online or if they call or if they just come into our office to set up an appointment. From there, it goes on to the sick or well exam. That's just basically where patient come in, either if you want a regular checkup or if you're already experiencing symptoms. From there, it goes on to the screening. There, you have any kind of screening for whether you want a CT scan or for a mammogram or anything like that. It goes on from the screening to our treatment center, whether you have to get chemotherapy or, you know, just a regular cold or something you have. And then from there, we go on to the follow-ups. From the follow-ups, after that, we'll have a nurse practitioner or a doctor or somebody contacting you, whether via email or a letter in the mail or coming to your house to visit you. And then from the follow-ups, we go on to, if it's either you go home or go on to rehab. And all that is done through our EMR system. EMR payments, and the EMR is a great way to improve quality care by just keeping patient records up to date. It's more easily accessible for doctors, other nurse practitioners. It also allows the clinical staff to track the patient needing follow-up care. We stole that point from Kemal. One patient equals one chart. It's just basically like it says, one patient and one chart, no matter where. If you go to another facility or if you go to another state or something, they'll still have access to your charts. We offer payment plans, and we believe that the government should make the EMR system mandatory for hospitals. And that's our scheduling and registration. Online registration is 24 hours. We provide emails and phone calls for reminders of screenings and follow-ups. We have efficient staffs. We also will be sending out letters as reminders via regular mail.
Our patient scheduling, patients will be scheduled every 15 minutes. They can schedule up to 99 visits for the patient in just seconds. Simultaneously schedule patients for the same provider without inadvertently double booking. Automatically schedule rooms and resources in conjunction with appointments, and automatic chart requests upon scheduling an appointment. This is basically our patient revenue slide. This is the physician's daily schedule. Patients will be seen every 15 minutes. They'll have 1 hour for lunch and 6 patients per hour. Patients will receive an email about their screenings. Immediately after 10 days of discharge, there will be a follow-up, and list of medications will be emailed and probably also mailed to the patient. Cancer-related checkup. This will be for patients that are 20 years of age or older. Yearly health exam, cancer-related checkup, health counseling, and other tests your doctor may determine that are relevant or that you should have. Surgical procedures. There's breast conservation surgery, which is basically the preservation of the breast as well as breast reconstruction. There's excisions and resections, which are basically the removal of tissue or the lump. There's laparoscopic, which is minimally invasive, and it's where they make small incisions, and palliative surgery, which is not a cure, but it relieves discomfort for the patient, and as well as sentinel node biopsy, which is when the node is drained and removed and tested for cancer cells.
Other therapies that we have are radiation, chemotherapies, biotherapy, which stimulates or restores the ability of the immune system to fight infection and disease, immunotherapies, interventional pulmonology procedures, and tests. It's an evolving specialty within pulmonary medicine that focuses on the use of advanced diagnostic and therapeutic techniques to treat the patients with lung cancer. And interventional radiology, which is minimally invasive targeted treatments performed using imaging for guidance, and orthopedic oncology procedures is a medicine that treats musculoskeletal cancer. Our support you groups and 24/7 hotline are here to help the patient and offer survivorship support as well as mind and body medicine. Cheer Me Up cards can be sent through our website to any patient within the facilities, and you can add your own message to enlighten their day. In order to save money on costs, we must be able to prevent and diagnose patients early to lower the cost of cancer treatments. Our EMR system will help patients with online scheduling and billing to help our practice become more efficient with a personable staff. We want to prevent ER visits, so anything minor, expected, or unexpected can be handled by our facility, which leads us to our pilot program.
And with our pilot program, we believe in getting very close to our patients. One way by doing so, we decided we were gonna get their cell phone numbers so we'll be able to check upon them. That by doing so, increase quality. Whenever they make an appointment, they could either see a nurse practitioner, or depending on the reason for their call, they'll be directed to the physician itself or the nurse practitioners. That, by doing so, will eliminate wait time and improve quality and efficiency, while also increasing revenue and the amount of patients seen. Also, patients will be able to issue, they'll get incentives card for every 5 consecutive screenings they do within a year. Patients will also have access to yearly seminars on cancer prevention, education, and tests that will need to be done in order to catch the cancer early. They'll also, patients or insurance companies will not be billed for surgery, admission, or follow-ups if for some reason complication occurs within 10 days, or individualizing treatments specifically to patients. We also included clinical trials involving preventative cancer treatments. We have a 24/7 helpline that a doctor or nurse practitioner is assigned to, The patients are given the numbers to that so that they'll personally contact the doctor or the nurse practitioner if they have any questions that has to do with the whether medication or if they're confused about something.
That's our website.
Yeah.
Yeah. That's it.
Done? Very nice.